Why do IGRA and TST TB tests give different results? Imagine trying to catch a glimpse of a hidden world inside your body. When it comes to tuberculosis testing, two main methods help us do that. The tuberculin skin test and the blood test called the interferon gamma releases assay. But sometimes, these tests don't agree, leaving doctors and patients wondering what's really going on. Let's explore why that happens. The tuberculin skin test involves injecting a small amount of purified protein derivative, or PPD, into the skin. After 48 to 72 hours, a healthcare worker checks for a skin reaction. If the skin becomes swollen or raised, it suggests the immune system has seen TB bacteria before. This reaction is a delayed type hypersensitivity, meaning it reflects a cellular immune response to TB antigens. On the other hand, the interferon gamma releases assay is a blood test that measures how T cells in your blood respond to specific TB proteins. When these T cells detect TB antigens, they releases interferon gamma, which the test then measures. The key point is that the blood test targets antigens that are unique to TB bacteria and are not found in the BCG vaccine or most non-tuberculous mycobacteria. Now, why do these two tests sometimes give different results? One big reason is their specificity. The TST can give false positives if someone has been vaccinated with BCG, which is a common TB vaccine used in many countries. The BCG vaccine contains a weakened form of TB bacteria, and the immune response it triggers can make the skin test react even if a person is not infected with actual TB bacteria. The IGRA, however, uses TB-specific antigens that are absent in BCG, so it is less likely to produce false positives in vaccinated individuals. This makes the IGRA more specific, especially in populations with widespread BCG vaccination. Sensitivity is another factor. Both tests are fairly similar in their ability to detect TB infection, but their performance can vary based on the person's immune system. For example, in people with weakened immune systems, like those with HIV, the tests might not work as well. The IGRA tends to perform slightly better in these cases because it measures immune responses in a more direct way. Still, neither test is perfect, and results can sometimes be discordant, meaning one test is positive while the other is negative. The way the tests are administered also influences the results. The TST depends on the skill of the person giving the injection and reading the skin reaction. It can be tricky to interpret, especially if the reaction is borderline or if the reading is delayed. The IGRA, being a blood test, is processed in a laboratory, which can reduce variability. However, factors like how the blood is handled or the person's immune status can still affect the results. Lastly, the history of TB exposure and vaccination plays a role. If someone has had BCG vaccination, their TST might be positive even if they are not infected with TB. The IGRA is designed to avoid this problem by focusing on TB-specific antigens. This difference explains why sometimes a person might have a positive TST but a negative IGRA, or vice versa. It's important to remember that no test can tell the full story alone. Doctors often consider other factors, including risk history and possible exposure, before making a diagnosis. In summary, the main reasons for different results between IGRA and TST are their different methods, the antigens they target, and how prior BCG vaccination influences the outcomes. The TST measures a broad skin immune response that can be affected by vaccination or environmental mycobacteria, while the IGRA measures a more specific immune response to TB bacteria. Both tests have their strengths and limitations, and healthcare providers use them together with clinical judgment to get the clearest picture possible. If you're ever unsure about your TB test results, it's always best to consult with a healthcare professional who can interpret the results in context and recommend the next steps.